It's day 12 of India's 21-day lockdown to stop the spread of the novel coronavirus. I'm Akhil Khadidar. In the next few minutes, we will bring you updates regarding the spread of this virus from across India with a special focus on Bengaluru and Karnataka. At the time of this recording, the total number of recorded cases in India is inching towards the 4,000 mark. Right now, India has recorded 3,950 COVID-19 cases. 3,543 people are active reported carriers of the coronavirus in India. 299 have recovered since they were first tested. The death toll has climbed to 108. Until last night, 79,950 tests for COVID-19 were done across the nation, among which 11,182 tests were conducted yesterday alone. The Indian Council of Medical Research has come up with an advisory for setting up laboratories in far-flung districts across the country. According to the advisory, the setting up of new center will be considered if the number of suspected cases is more than 100 per day in that location, and the nearest testing lab is over 250 kilometers away in the plains, and over 150 kilometers away in the hilly regions. To have a testing facility, the district should also have a BSL-2 level government lab, including a molecular biology setup for virology diagnosis. They should also have trained staff in laboratory biosafety and biosecurity who are trained to handle respiratory samples for viral diagnoses, amongst other things. If the district does not have a government lab but has a private lab instead, it should have NABL accreditation. And the scope of accreditation must include real-time PCR for respiratory viruses. Moving on to the states, Tamil Nadu reported a staggering 86 novel coronavirus cases today. The number of active cases in the state now stands at 558, out of which 422 are from the Nizamuddin cluster. The state has reported 5 deaths so far and has tested over 4,000 samples. Maharashtra has 594 active cases. The state reported 8 deaths today and has lost 40 people to the virus so far, the highest in the country. Kerala recorded 8 fresh cases today and has 256 active cases in the state. Jammu and Kashmir saw a steep rise in COVID-19 cases for the second consecutive day. 14 people tested positive on Sunday, taking the active cases in the Union Territory to 101. In Morena in Madhya Pradesh, 26,000 people have been placed under home quarantine after 10 people who attended a funeral feast tested positive for the virus. The funeral feast was arranged by a man who returned from Dubai but had concealed his travel history. The man and his wife have also tested positive. The state has 169 active cases and has reported 10 deaths. 7 fresh cases are reported from Karnataka today, taking the tally of active cases to 135. 12 people have been discharged so far, and there have been 4 deaths in the state. 3 people are in the ICU, 2 on ventilators, and 1 on oxygen support. Of the 7 cases reported today, 2 are from Bengaluru. 1 is a direct contact of a patient diagnosed earlier. The other has a travel history to Dubai. Both patients have been so far asymptomatic. 4 cases have come in from Raibag and Belagavi. All of them had attended the Tablighi Jamaat conference in Delhi. The last patient is from Ballari and had also attended the Delhi gathering. Though he has tested positive, he remains asymptomatic so far. Any person from the state who's attended the Tablighi Jamaat congregation at Nizamuddin Markaz Masjid in New Delhi, kindly contact Aayog Reaches on the number displayed on your screen. Contact tracing of those who attend the Tablighi Jamaat gathering in Delhi is underway across the country. In Kashmir, 6 people who had been quarantined after attending the gathering in New Delhi tested positive for COVID-19 on Saturday. The nodal officer for COVID-19 in Kupwara district said that contact tracing had begun even though the patients had not visited their hometown after the event. 6 pockets in Kanpur district have been declared red zones after 6 Tablighi Jamaat members, including 2 foreign nationals, tested positive for the coronavirus. The patients are said to have visited these areas. Police have deployed drones in the red zone areas to monitor people's movement and unlawful assembly amid the lockdown. Immigration officials intercepted and detained 8 Malaysian nationals linked to Tablighi Jamaat at the Indira Gandhi International Airport. The Malaysian nationals were among 30 others who were being evacuated in a relief flight. The Ministry of Home Affairs has revoked visas and blacklisted 960 foreigners belonging to Tablighi Jamaat on charges of violating tourist visa norms by carrying out missionary activities. The 8 Malaysians were handed over to the Delhi police and have been shifted to a quarantine facility. In Chennai, 10 Malaysian citizens linked to the Tablighi Jamaat were prevented by immigration officials from flying out on a charter flight. In Uttar Pradesh's Ghaziabad, 10 Indonesians who attended the religious gathering have been booked under various sections of the IPC, the Epidemic Diseases Act, and the Foreigners Act. A local guide and 4 others who provided accommodations have also been booked. The Indonesians had been placed under quarantine. In Navi Mumbai, 10 Philippine nationals have been booked under similar sections. Moving on, the Indian government has reached out to over 92,000 NGOs, industry associations, and international organizations to tackle the COVID-19 pandemic. The initiative has been undertaken by the Empower Group chaired by Amitabh Kant, the CEO of Niti Aayog. He has written to NGOs registered on the Darpan portal appealing to assist the government in identifying hotspots and deputing volunteers and caregivers to deliver services to the elderly and other people in need. It also reached out to startups who are working on innovative ventilator designs, testing tools, and tracking solutions to understand their scale and possible contributions. A 26-member medical team comprising senior doctors has also been sent from Thiruvananthapuram to Kasaragod to strengthen COVID care operations in the district. 123 people have tested positive for the novel coronavirus in Kasaragod. 195 people have been hospitalized with symptoms and over 10,000 are under home quarantine. The Kerala government has started work to turn the administrative block of the upcoming medical college in Kasaragod into a COVID hospital with 200 isolation beds and 20 intensive care beds. The patients are currently being treated at government hospitals in the district which have limited facilities and infrastructure. The Federation of Hotel and Restaurant Associations of India has voluntarily offered the government access to over 45,000 hotel rooms from across the country. Rooms have been set aside to quarantine inbound tourists who may require quarantining, as well as for others who are stuck in the country because of the travel ban. The rooms are also open for doctors and healthcare workers who are unable to commute from their homes every day. The hotels range from 5-star properties to standalone properties and have been selected based on the cluster regions identified by the government authorities. Alongside, the Hotel and Restaurant Association of Western India has been offering meals, food packets, and meal preparation facilities, besides distributing dry rations for the needy through its restaurant members. A quick look at what's happening in Karnataka. Former Chief Minister and JDS leader H.D. Kumaraswamy criticized the Prime Minister's call to light candles on Sunday night. He questioned whether the BJP, which is not ready to celebrate its Foundation Day owing to the lockdown, was indirectly using the people of the country for the purpose by making them light lamps. He also criticized the government for not providing doctors with PPEs or making the tests affordable, but instead giving meaningless tests to the country. The Mangaluru Police Commissioner took to Twitter today to express his displeasure against those violating lockdown rules. The Mangaluru City Police have seized 386 vehicles for violating lockdown orders in the last 2 days. The Dakshina Kannada District Administration had imposed a total ban on movement of private vehicles from April 2 in the district to prevent the spread of COVID-19 and to check unnecessary movement of people. All churches coming under Mangaluru Diocese remain closed today despite being Palm Sunday. Bishop Reverend Peter Paul Saldana conducted Holy Palm Sunday services inside the cathedral, and this was streamed online. The Karnataka State IT and ITES Employees Union has said that some IT companies, as well as those in the IT-enabled sector, have been cutting salaries and sacking people, despite a government order prohibiting such an action during the 21-day lockdown. The union has demanded the government intervene in this matter. It has also requested the government to take strict action against the companies who violate the advisory and labor laws. Before we go, the COVID-19 pandemic has pushed the boundaries of innovation and students have responded to the challenge. Students from Sahyadri College of Engineering and Management in Mangaluru have developed a design for a face shield that can be used for frontline healthcare workers. Face shields are a key piece of equipment for those working in close contact with COVID-19 patients. Face shields can protect a healthcare professional from exposure to droplets containing the virus expelled by patients when they cough or sneeze. The students have supplied more than 1,000 face shields to various hospitals in Mangaluru. The product was developed as part of DreamWorks Makerspace, which is guided by startups in the engineering college. That's all we have for today. Stay safe, stay indoors, and we'll see you tomorrow.